Good afternoon, everyone. I'm Diana Rauner, the president of Start Early and co-chair of the Early Years Climate Action Task Force. Thank you very much for joining the first public listening session of the Early Years Climate Action Task Force. This task force is charged with drafting the first ever Early Years Climate Action Plan for the United States. The task force will identify best practices for government, child-serving systems, businesses, not-for-profits, and philanthropy to mitigate, adapt, and respond to climate change as it relates to young children and their families. It will also develop policy frameworks for implementation at all levels of government. The task force will hold a series of listening sessions. This is the first, highlighting the particular vulnerabilities of young children to climate change and opportunities for the early years sector and the climate sector to participate in and change opportunities for action. It will hear from parents and guardians, children, caregivers, pediatric health providers, subject matter experts, and grassroots advocates. The task force's work will also highlight the experiences of Indigenous and Native American communities, people of color, those on low incomes, and those living in particularly climate vulnerable communities. Now I'd like to pass things over to my co-chair, Antoine Ford.
Thank you, Diana. How are you? Again, my name is Antoine Ford. Good afternoon or good morning to wherever you are. I'm Antoine Ford. I'm president and CEO of Enlighten Incorporated, but also work in the chair of the board for the DC Workforce Investment Council and secretary of the National Association of Workforce Boards. Today, we have a great panel to help us understand why we should have early years sector move towards climate action and how climate change impact early childhood development. This is a moment of unprecedented investment in clean energy, infrastructure, and other strategies to meet our obligations to the future. Our work as a task force presents an opportunity to make sure the needs of young children and their families and communities are at the forefront of climate action at all levels of government across the United States. We will hear from each panelist first and then ask task force members to be able to ask questions. We really encourage you to participate. We are joined by to introduce some of our panelists, and then I'll turn it back over to my co-chair. Ann Lombardi is a senior scholar at the Center for Child and Human Development and a senior fellow with the Collaborative on Global Children's Issues at Georgetown University. I wish it had been GW where I went, but I like Georgetown too. Over the past years, Joan has made significant contributions in the area of child and family policies as an innovative leader and a policy advisor to national and international organizations and foundations as a public servant. We also have Erin Bernstein, is the interim director of the Center for Climate Health and Global Environment at Harvard T.H. Chan School of Public Health. Is also a pediatrician at Boston Children's Hospital and an assistant professor at pediatrics at Harvard Medical School. Dr. Bernstein focuses on the health impacts of climate crises on children's health and advancing solutions to address its cause to improve the health and well-being of children around the world. Diane, do you want to introduce our other panelists?
Thanks, Antoine. I'll continue with Jacqueline Patterson, the founder and executive director of the Chisholm Legacy Project, a resource hub for Black frontline climate justice leadership. The mission of the Chisholm Legacy Project is rooted in a just transition framework, serving as a vehicle to connect Black communities on the front lines of climate justice with the resources to actualize visions. Prior to the launch of the Chisholm Legacy Project, Patterson served as the senior director of the NAACP Environmental and Climate Justice Program for over a decade. During her tenure, she founded and implemented a robust portfolio, which included serving the state and local leadership whose constituencies consisted of hundreds of communities on the front lines of environmental justice. She also led a team in designing and implementing a portfolio to support political education and organizing work executed by NAACP branches, chapters, and state conferences. Laurence Chandy was appointed as UNICEF's first director of the Office of Global Insight and Policy in August 2019. He previously served as UNICEF's director of data research and policy, a position he held from 2017. Mr. Chandy came to UNICEF from the Brookings Institution, where for 7 years he was a fellow in the Global Economy and Development Program. There he conducted research on global poverty, fragile states, aid effectiveness, and globalization. His work, including through his membership in the Atkinson's Commission on Global Poverty, shaped reforms on global poverty measurement and helped make the case for establishing the goal to end extreme poverty by 2030. And finally, Luz Drada is a program coordinator for Moms Clean Air Force. She has had an interest in sustainability and the common good throughout her career. After becoming a mother, she became aware of the climate crisis and the impacts of climate change and air pollution on children's development. Thank you all for joining us here today, and we will begin with Joan.
Thank you, Diana, and thanks to Antoine and the organizers, the task force members, and all of you who are participating. It's an honor to be asked to make some very brief remarks before you hear from this excellent panel about why it's so important for the early childhood field, a community that I love, why we should be involved in climate action and environmental justice. I've had a 50-year focus on young children. The scientific evidence and common sense have provided us the answers to these things all along. But recent events from Puerto Rico to Pakistan, from Flint to Jackson, have really been a wake-up call. These events, along with the pioneering work of early childhood advocates around the world, have helped galvanize action. There are many reasons why we should be involved. Let me just state 3: vulnerability, solutions, and opportunity. First, the developing child is the most vulnerable to environmental degradation and climate change. The impact of air pollution, drought, heat, lack of access to clean water. Young children bear the biggest burden, despite the fact that they've had the least responsibility for causing it. Particularly true for children in low-income countries and communities here that have had a history of racial discrimination. Every aspect of nurturing care, health, nutrition, access to early learning, safety and security, even a parent's ability to be responsive, is impacted by environmental factors. So the bottom line, environmental issues affect the trajectory of child development, and that's the first reason that we have to be involved. Second, our work in early childhood is a critical part of the solution. It's been said that children are not just vulnerable, but they're valuable. Supporting healthy development is a pathway to a different future, a pathway to a world that is more sustainable. When we grow healthy children, we're building their resilience and their adaptability to changes that they will inevitably see. Across our work with parents, with children, and with community system building, we're part of the solution. We support parents impacted by the environment. We help them respond. We help them prepare. We help them cope. We provide them hope. We can even connect them to green jobs, to better jobs. We support children by creating a generation that values the earth, that encourages them to disconnect from devices, at least sometimes, and connects them with the joy of nature. We support communities in moving to a more green environment. So I want to acknowledge that this issue is coming at a very difficult time for our field. The stress of COVID, the lack of public investments. We have to acknowledge that the capacity of the field is strained, but that's exactly why my last reason for us to be involved is that it's an opportunity for us to build new champions with environmental activists, with youth activists who are such a hope and inspiration, and for elderly activists that are concerned about the future of their grandchildren. In all these years, I've never felt such a sense of urgency coming at such a difficult time. But we plant seeds, we teach curiosity, we understand persistence, we get things done. We have to be involved. Equity and justice is part of the early childhood mission. We don't have to be experts on climate. We do have to help build awareness of what's at stake for children. We do need to understand the impact of not acting. We do need to be seen as part of the solution in partnership with others. This is not someone else's issue. It's our issue because it's a child rights issue. Every child has a right to a future, to live every day in a clean and healthy environment, from Nairobi to New York, from Dhaka to Detroit. I want to thank the task force members and all of you for listening. It's really a wake-up call for all of us.
Thank you, Joan. We'll now hear from Aaron Bernstein.
Thank you so much. And what an honor to be here. And I feel I should take out a new policy, which is never to speak after Joan Lombardi, because there's not much left to say, is there? This is an extraordinary occasion to see folks in the early childhood world engage in climate in a full-voiced way, with an opportunity to really do something that I think has really evaded our decision makers for a long time, which is to put children first in this context. I'm a pediatrician and a dad. I've been working at the intersection of climate and health for over 20 years. And at the root cause of I think, even our best efforts on climate is the lack of appreciation for the reality that the real measure of progress on climate change is our children. Whether it comes to the policies that govern air quality, how we make decisions about our food systems and transportation systems, and this is as true in our country as anywhere, we fundamentally designed the field to favor adults, and that's under the belief that if the adults do well, the children will be okay. And that sort of worked for the 20th century. But with a problem like climate change, it actually is a surefire way to make sure that our children don't have the world that we would want for ourselves as children. And so I think at a broad level, this activity is critical because it's one of the very few that I know of that is squarely focused on what is the root cause, in my view, problem with policymaking around climate, which is that children are discounted. And in fact, children cannot be discounted. And that's true for everyone. If we want the adults to be okay, we actually need to put children first here. And I know I'm very much speaking to the chorus when I say that we can do that in a lot of arenas, not just this one. Now, I was asked specifically to address the intersection of climate and child development, and I think that underscores the point I was just making. So there's research, which many of you may be familiar with, showing that a child born in the world in 2020 will experience many times, depending upon where you are on the planet, 4, 6, 8, in some cases, depending upon the kind of climate shock, multiples of that, times the number of extreme events in their lifespan as someone born in 1960. Let me just underscore that. So a child born in the world in 2020 is probably 4 times likely to experience a life-threatening heat wave, a hurricane, a fire, a flood, a drought, a food shortage because of climate change, than a child born in 1960. And as we move forward in the century, that intergenerational inequity will grow. So we can't simply base our decisions about value on current circumstances because we already discount children in the present, but moving forward, the inequity is yet greater. So that's one point. Another critical point is what climate change does to the developing mind and body. So there is a generation of research that has painfully shown us that we have so much at stake. And again, I know you all know this stuff backwards and forwards, in making sure that children are protected from the adverse childhood events that are always a part of childhood. Sadly, no child really makes it through life as a child without one. But we know that what needs to be deployed to buffer that those adverse events, to prevent what many call toxic stress. Climate change is really like it is adverse childhood events on steroids. Children, if you ask a child to draw their family in say the 1st or the 2nd grade, they will draw figures of the people who live with them, and they will almost certainly draw a picture of their home or where they live. And that's because a child's identity is so squarely based in this home environment. Now, of course, not all children are so fortunate to have that, but those that do will do that. And so it's not surprising that when a child's home is destroyed by fire, by flood, if a child is forced to move because their family can't afford utility bills. This is another well-studied area of child development, that housing insecurity is a major contributor to both, of course, health outcomes tied to utility costs. That these events really shape a developing brain that really brings out the weaknesses that are embedded in each and one of every brain ever created on this planet. So all of our brains are vulnerable to mental health disorders, to addictions, and these adverse childhood events essentially shape the developing brain in ways that make these tendencies come out. And so we see decades after children are exposed to these events, unbelievable disparities in health outcomes, and not just in things like substance abuse and sexually transmitted diseases and mental health disorders, but in cancers and heart disease. And so we need to be clear that we can't really talk about healthy child development in the absence of climate change, nor for that matter can we talk about health equity without talking about climate change. Health equity requires climate action. It's not a maybe. It's not a, and I think that these are the kinds of issues that this task force is uniquely well positioned to put in front of policymakers, because I can tell you, having done this for a while, children are not often presented, if any, even in things like the Clean Air Act in the United States, which is an amazing example of success. Child health is included mostly in the form of asthma and sort of there, but no other value of child welfare, even from all of the research we have, showing that air pollution, which of course is just one very small wedge of this issue, has dramatic effects on child health. So I hope that underscores the value of this task force, and what Joan so eloquently put before me about why children are so important to focus on. We have to put children, the value they bring to our lives and our world, the fact that they have much more at stake, and that there are very real, tangible effects of climate on child development that are really going to roll back, and already have in many communities, the amazing progress that's been made in early childhood development, and really delighted again to have the opportunity to be with you.
Thank you, Aaron. I think what you said, there was an aha moment when you said that children are discounted. One thing that climate and the early childhood field have in common is that the future is discounted in our public policy, and that's pretty clearly happening in both sectors. Next, we'll hear from Jacqueline Patterson.
Thank you so much. Yeah, so it's an honor to be here with you all, and it is such a topic that fills one with angst and sadness, but also with hope and some of the solutions that we will hopefully be talking a lot more about. And it's, if anyone can advance the solutions that we need, it is folks on this task force. So excited to be a part of this conversation. So we put out a report earlier this year called The Racism That Upends the Cradle, 25 ways that Black children are disproportionately vulnerable to the kind of converging crises of climate change, COVID-19, and the economic crisis. And so in it, we really detailed particularly the ways that Black children are impacted by climate change and the entire climate change continuum. And already Dr. Bernstein gave some of those factors. And when we talk about the entire climate change continuum, it is from the drivers of climate change and the toxic practices that impact the health and well-being of communities. And it's not just Black communities, I should also say, Black communities and BIPOC communities in general, Black, Indigenous, and people of color communities, And the work that we do is focused on Black children, but definitely I'll make some references to where there's overlap with other BIPOC communities as well. And so whether it is the toxic facilities, from the fact that oil and gas facilities, coal-fired power plants, near roadway air pollution, incinerators are all disproportionately located in BIPOC communities, and particularly Black communities, that results in the higher risks of particle pollution, carbon dioxide, nitrogen oxide, sulfur dioxide, all these different toxins that are impacting the health and well-being of children. One of the statistics that one hears the most is around asthma, and that Black children are 4 times more likely to be hospitalized for asthma attack and 10 times more likely to die of an asthma attack than white children. And so also I want to back up a minute and say that some of the historic issues stemming from when Black folks were brought over to be the enslaved labor for this nation formed the foundation for where we are today in terms of both the lives not being valued. And this is why you hear of this kind of call for Black lives to matter, because of the dehumanization and lack of valuing of lives. And then some of the structural ways that plays out, from redlining and segregation and so forth, that still goes on today. And so we have our communities are more likely to be in the shadows of these toxic processes that result in pollution, to the fact that we're more likely to have these food insecure communities, as was referenced before, more likely to have homes in floodplains, more likely to suffer housing insecurity and displacement. And so all of this directly overlaps with the vulnerabilities that make one more subject to the impacts of climate change. Lack of economic mobility is directly, unfortunately, even tied to the extent to which one is represented in a democracy, because of those economic challenges then result in the lack of political power. And so we know that Black children are born in the top 5th of income distribution only have an 18% of chance of staying there into adulthood. So the lack of being able to even maintain, much less even to advance in economic mobility, is a chance, is an issue. While white counterpart children have a 41% chance of staying in their same economic strata. So this is where you start to see some of these challenges. That, in going back to the segregation and redlining, we know that Black people are 40% more likely than other groups to currently live in places where extreme temperature driven by climate change will result in higher mortality rates. And so that's not just being even born into those situations, but even there are reports that came out earlier this year about urban heat and maternal mortality. So being able to actually survive through childbirth is challenged by where a lot of Black children and Black families live. We know that shifts in agricultural yields is one of the impacts of climate change, and that Black American households face hunger at a rate more than twice that of white and non-Hispanic households or non-Latino households. Getting enough to eat is a constant struggle for 1 in 4 African American children, and again, only exacerbated by the shifts in agricultural yields that result from climate change. We know that water scarcity is one of the challenges that is already happening and will continue to happen in the context of climate change. And we also know that that Black children are more likely to live in communities that have polluted water. We see that Jackson is in the headlines, but that's just the headlines. They're all the places where there's an invisible daily disaster of lack of water in many, many communities. So in my waning 30 seconds, I will also say that another challenge is that with the US being 4% of the global population, I mean, yes, with US being 4% of global population, but 25% of the emissions that drive climate change, we're directly responsible for the fact that many nations have becoming uninhabitable for folks in the global South. And yet when people are immigrating to come here, then people are put in cages or greeted by officials on horsebacks using their reins as whips. And it's Black children, Latino children that are suffering under that kind of greeting. And so And I'll wrap with talking about the disproportionate impact of climate change and climate grief on children, because given that there is this heightened level of loss that's happening, that stress and anxiety disproportionately impacts children in general, and Black children, because of the impacts are more. So those are just laying out some of the why, and I look forward to the further question and conversation about the what we need to do about these impacts. And again, you all are the folks that we need to be having this conversation with and leading on the solutions. So thank you. I'll hand it back.
Thank you so much. I want to remind our task force members that you can put your questions in the chat, and that is moderated, and we will have conversation and questions after each of the presenters speak. Laurence Chandy is next.
All right. Thank you, Diane, and thank you, Antoine. It's a real honor to be here. I want to convey 4 points to colleagues today. So the first one is that climate change is going to affect all children's lives. Last year, some very smart colleagues of mine at UNICEF conducted a mapping exercise where they looked at available data on where climate hazards are expected to hit and where children live around the world today, to understand how many children, what share of children are exposed to different climate hazards. They were looking there at heat waves, at cyclones, at air pollution, at flooding, water scarcity, vector-borne diseases. And what they found is that more than 99% of children are exposed to at least one of these climate hazards or stresses. So this is not a minority issue. This is an issue that will affect all children. They also found that more than 2/3 of children around the world, so 1.7 billion children, are exposed to at least 3 of these climate stresses or hazards. So that's my first point. My second point is that in a climate era, the strategies we pursue to in pursuit of social policy or economic development are going to have to radically change. What we're seeing in those big numbers I cited earlier is what I would describe as this sort of fundamental evolution in that core challenge of social policy and economic development. Historically, we've really thought about those challenges as one about deprivation. There are children around the world who lack food, education, healthcare, and the challenge is to equip them by their families, by their communities, with the means to provide those for them. But today, the challenge is increasingly one about insecurity. So we've entered this era where shocks, whether localized or global in nature, are becoming more frequent and more intense. And climate change is clearly a major driver of this. And we see this very starkly in the data. So I, in a former life, when I was at Brookings, I did a lot of work on global poverty measurement. And I spent a lot of time drawing the same chart over and over again, which was a very happy chart showing the share of people in the world living in extreme poverty. And it's been trending down for years and years. But what we're now seeing is while that trend continues to go down, albeit at a slightly slower pace than in the past, the share of people in the world who are in food insecurity, that's people who have to go without meals for a day, is trending up. The share of people who require life-saving humanitarian support, that's going up too. And when you see this chart, when you see these lines heading in different directions, when you first see it, you think this can't be right. There's got to be some kind of, we're measuring something wrong here. But it's perfectly plausible that these two things are happening at the same time. So this sort of shift from deprivation to one of insecurity. And I'd argue that we're going to start to see something similar happening in the US, in the sense that who we need to target with our support and how we design interventions is going to have to change as insecurity becomes the core challenge of social policy and economic development. My third point of 4 is that we should be especially concerned about children facing shocks in their early years. So I've made the point that insecurity is the key issue of our time, but we should be especially concerned about insecurity in those early years. So, I think we all know on this call, but Children's early years, they're the formative years. It's a time when the brain is developing. We've already heard about the particular challenge of high levels of toxic stress being especially harmful to children. This is a time when nutrition and stimulation are key. And it's the time most in life when timing matters. Investments in early years were first sold as a smart investment because of their large returns that play out over individuals' lives. They've also been sold as the great equalizer. If you invest in early years, it's an investment in equal opportunity. Now, I would argue an investment in early years is an investment in resilience. It's shielding people from the shocks they'll face the most vulnerable time in their lives. And the fourth and last point I want to convey today is that countries around the world are slowly waking up to this reality. There's a forthcoming study from UNICEF, which I think we're going to release shortly before the next COP meeting, which reviews the NDCs, the nationally determined contributions of countries around the world. This is where countries assess their contribution to the Paris Accords. And what we do in this report is we assess whether these nationally determined contributions are child sensitive. What do I mean by being child sensitive? We look at whether the policies to support essential services for children are climate and disaster resilient, and whether policies are inclusive of children's rights, their participation, and their role as change agents. And I can preview today, I think without giving away the headline from the report, that in 167 countries where we assessed their NCDs, approximately 2/3 of those countries, the nationally determined contributions meaningfully reference children, but only a minority of those countries are judged to be truly child sensitive in terms of the policies they're pursuing. So there's progress, but there's more work to do. We do have various examples around the world of countries, I think, doing very bold and decisive things to make their child policies relevant and responsive to climate change. Maybe to name a few, in Argentina, they've passed a comprehensive environmental education law that equips the next generation with the skills they'll require for the climate era. And that's focused very much on inclusive of the early years. In India, they have disaster risk management plans that are, I think, very effectively child-centric. And despite, I think, many mistakes made during COVID, I think there was evidence of that, where the vaccine programs during the pandemic were maintained in India, where in other places they were put on hold. In Mongolia, there's social assistance programs targeted at children that are able to flex in response to shocks, which I think is a key example of a successful policy. And in Indonesia, there are community health workers who are teaching families about changing disease vectors. So when you look around the world, you can see, I think, some powerful examples which the US can learn from and emulate. So thank you for the opportunity to provide a testimony, and looking forward to hearing more from the task force. Thank you.
Thank you. And finally, Luz Drada.
Hi, good afternoon. Thanks for having me as a guest speaker to discuss such an important topic today, early years in climate action. I am Luz Drada. I am a mom. I am the program coordinator for Moms Clean Air Force. It's a community of over 1 million of caregivers across the country who advocate for clean air and protect the children for climate action. I am a mom of a 5-year-old. I am an immigrant who grew up during the most challenging times of the history of my country, Colombia. I witnessed the displacement of families. In my teens, I got involved in philanthropy and lead initiatives with disadvantaged communities and animal rescue. As a mother, I am a climate advocate, convinced that climate change is the greatest threat to our children on this planet. And for me, being parent these days means, among other things, dealing with eco-anxiety. Climate change will have lifetime impacts on the health and development of our children, who will have to live with the consequences of an unprosperous planet, increased temperatures, and natural disasters that can compromise food security. As a mother, To me, it's terrifying to think that my 5-year-old son, Dominic, will have to navigate the impact of climate change throughout his entire life. Circumstances that mark my childhood make me step up and tackle my interests and the common good. And becoming a mom and developing a high-risk pregnancy and giving birth a premature baby made me reflect on the urgency of this climate crisis. Health outcomes can last a lifetime for some children that are born premature. And climate change is making preterm birth more common. Air pollution, extreme temperatures, and other climate impacts threaten maternal health and pregnancy outcomes that can affect socioeconomical disadvantaged population. Early life experience like preterm birth and other trauma like climate displacement can affect long-term physical and mental health. I know what is to be the mother of a premature child. I know how heartbreaking that is. And I know all the emotionally and the financial cost that it carries to families. I become a climate advocate because my son's generation has a future that is at stake. In 2020, I decided to return to school and get my master in natural resource and global sustainability because I wanted to be part of this solution and take actions to mitigate all the damage that caused living in a prosperous fossil fuels economy. I belong to a national organization that advocates for clean air at the federal level. Our moms met with legislators at all levels to build support for healthy solutions to pollution and environmental justice. I am also part of the Ecomadres core team, which is the Latino outreach of Moms Clean Air First, whose mission is to protect Latino families' health. The Latino population is disproportionately hit by climate impacts due to where we live, play, and work. So when I was asked what would I would like to see from child providers and policymakers to do to support young children as they take climate action. As a parent, we need providers to have a comprehensive education on climate change and the effects on physical and emotional health. Parents, we need support to have healthy birth outcomes. We need mental health support to deal with the long-term consequences of preterm birth and high-risk pregnancies. They can be traumatic and complicated postpartums, anxiety and depression, because we cannot deny the mental health of parents is closely related to the mental health of young children. Thank you.
Come off of mute. Thank you guys so much. I really appreciate it. Now I got some questions out here. I really want to get to it. And really great questions. So the first question that we have, and please put your questions out there, one question at a time, please, so we can get to as many as possible. Panelist Lombardi, first question is for you. It says, climate change is certain to increase inequities and conflict, but we are already not handling our current inequities and conflicts in an adaptive, collaborative, and reparative manner. How do we best prepare the next generation approach as the next generation approaches challenges with an appreciation for inclusivity and collaboration over tribalism and social isolation? That's a great question.
You know, it's the mission of early childhood to do exactly that. And I think we already had inequities. It was clear from all the panelists. And the questioner is right. Of course, they're going to increase, but I think that's all part of our core mission. That's why we have to be involved in this. And we have to make relationships with children and between parents and children the core of what makes them less vulnerable to the shocks I think they're going to feel. I think that was Dr. Bernstein's message to us, but it's a challenge. I grant you that.
Excellent, excellent. Next question is from Angie, and this goes to Jacqueline and Luce, and if you can turn your cameras on when you answer, that'd be great. It says, I work in the child sector, especially thinking about the built-in environmental and childcare facilities. How are your efforts connected to childcare advocates? And the comment is, I think there are a lot of potential here. I've included a link. There's a link here for a piece of, it's called LIFF or LIFF, co-authored with the Center of Cities and Schools at US Berkeley. So that'd be great for either Jacqueline and then Luz, follow by, if you guys can address that question.
Luz, do you want to go first or? Okay,
You can
good.
go first.
Okay. Go ahead, Jacqueline.
No, I was asking if Luz could go first, but okay. I will try to. Yeah, so a few things. We, in terms of the built environment and childcare facilities, definitely there is there's a link with the work around green schools initiatives, and thinking of green schools as beyond just energy efficiency, but including energy efficiency and so forth, and solarizing our schools, building electrification and so forth, but also thinking about the ways that our schools are part of community, and our childcare centers are part of community, and that are and making sure that we are growing, to the extent that we can, growing foods as part of our childcare facilities, so that children are able to eat healthy and nutritious foods, and particularly produce, in communities where too often there are people don't like the term food desert, because it implies something that occurs naturally, and we know that the systemic nature of food insecurity, and so that thinking more kind of comprehensively and holistically about what it actually means to provide child care, and in that kind of way, is the ways that we've been working around integrating childcare facilities into this whole green school framing, and broadening the green school framing to be more holistic. So those are a couple of examples that I'll say, and then I'll hand it off to Luz.
Thank you, Luz.
Sure, thanks.
Yeah, complementing to what Jacqueline said. We make sure at Moms Clean Air Force that the resources are available and accessible for everyone. For example, electric school buses. We just want all our counties to take advantage of all the resources available for the federal government, so we can have this transition in school districts for having healthy communities.
Thank you so much. And I'm hoping we're really learning from these answers and questions and tying them together. Joan, this following questions for you is from Dr. Lynette. You shared that we don't need to be experts on climate to make an impact. That's a very powerful question. And that equity and justice is part of the early care and educational arena. How do we help integrate this message we're hearing today into the field that we're seeing that's so overwhelmed?
Yeah, it's a thanks, Lynette, for that question. And, that's why I wanted to acknowledge the state of the field when I was giving my reasons why I think we should be involved. Diana said something at the beginning. She said children and climate both don't have a future orientation. And that's what I think we're trying to say to the climate activists. We are part of the solution. We need each other. The early childhood advocates and the traditional climate advocates, the youth activists, kind of bridge that divide. One of the things that has allowed me to get excited about this issue that I wanted to share with my field is learning what other countries are doing and what other early childhood advocates are doing all around the world, creating nurturing neighborhoods in India, looking at how they can help parents get involved in the issue and support them during crisis. So, I know the times are tough, but that's exactly the reason we have to double down our efforts and get excited about being part of this. Maybe there's new content here. Certainly connecting kids to nature is part of it.
I really appreciate you're getting excited and getting passionate about this so that we really carry this. Aaron, I'm gonna throw this out to you, and then Laurence, I have a question for you. The question that we see here is, let me make sure, in your view, what are we not measuring in terms of early childhood well-being that we should be measuring? What are we not measuring that we should be measuring? So Aaron, if you're there.
I am. It just takes me longer than it should to find me.
There we go.
So, I think in many cases we've measured but not acted. So there's this enormous, Simone mentioned, Lou's mentioned this. We know a lot about how climate change affects children, whether that's from the effects of the shocks or the pollution that fossil fuels create. And we simply don't incorporate that. And this is a question of political voice and power. An example of this from my life is many of you will know of a study called the 6 Cities study. This is a study that sort of put on the radar that air pollution was killing lots of people in the United States. And when I talked to one of the authors of this paper years ago, and he said to me that they thought when this paper was published showing that air pollution was from coal-fired power plants was killing hundreds of thousands of people in the United States, that this would be a crisis, that people would say like, wow, like this is terrible. And it was kind of I don't think it was a dud, but he sort of made me feel like this was just no one really paid attention. And then he said they scratched their head because they realized this was one of the biggest public health issues in the country. He said, okay, let's do a different analysis. Let's look at the effects of the same air pollution on the rates of heart attacks in guys between like 40 and 60, mostly white. And lo and behold, they did that study and air pollution became a crisis. And this is what we face here, folks, is that children don't vote. They don't have money. And so when push comes to shove, as Diana Rauner alluded to, they're discounted. And this is why this work is so critically important, because if there were any generation that owed it to its children to speak up more, I don't know that it's ever happened in human existence, because so much is at stake here. And I think we've all underscored that. So the question of measurement it is partly, to me, that we need to look at what we know and voice it in ways that are powerful. But surely the other thing, and I'll say this, is that we absolutely need to measure children, and several of my fellow panelists measures, when we come up with climate policies, or for that matter, policies focused on any of the causes of climate, or even the resilience plans, and this has been alluded to, including by Laurence, we have to think about children. I can't tell you how many times I have had to review policies and manuscripts as if children didn't exist. And they're implemented on the basis of assessments of adults. And so I think one of the things the task force can make very clear, that we should never allow policies to be implemented in the absence of considerations of child welfare. Now, interestingly, in the United States and other countries, this is actually required. And so when you get into the weeds on this, there are standards of evidence that there's a lot of weeds that people find ways to exclude children, more or less. So the data that is present is excluded on technicalities. And we can talk about that, but there's no question that we should at least have it explicit that we simply cannot do these things. It's not okay to do these things without valuing children.
No, thank you so much. What I'm going to do after this question, and Laurence, I want you to answer that question, but if you could lace it with some of the things they're measuring overseas. I was really fascinated with the fact that there were examples. So they must be measuring something that we're not, or they must be doing it more effectively. So if you can help us with that. And then I'm going to have people come off of mute that have questions, and I'll ask you to ask your own questions.
Thanks, Antoine. I was just going to add, I wanted to add something to what Aaron just said so brilliantly, which is, I think we do a very good job in the US. I have kids in public school in the US, and we do a very good job of monitoring the child, right? And we have a lot of indicators. I know a lot about their learning. I know a lot about their health. Of course, if the climate affects those things, it's, we're going to know after the fact, right? We're going to know that things are going wrong. We don't do such a good job of monitoring the environment. I would love to have data on the environment in which my children play and where they go to school, and the pediatric unit. We don't have a lot of that sort of data at the level of infrastructure facilities. I think that's something which would be very powerful, and perhaps, I'm trying to be optimistic here, might trigger the kinds of kind of reactions that Aaron wants, right? Because if we see worsening conditions in those places, then hopefully one would hope that parents and communities would act. So I think that that's sort of, if there's something missing in monitoring, that might be it. In terms of overseas, I think it's a really good question, Antoine. I don't know if I have a good answer for a country who's kind of got the monitoring kind of really strong. The one thing I can think of is there are, I know that in East Asia there have been efforts to incorporate into the sort of the standard school monitoring systems, the kind of thing I've just been describing. So sort of so regular monitoring of the environment as part of the kind of the data, the kind of the big data sweep that that occurs throughout the country in all schools and is sent up to the center and comes back down again. So I think that's in Cambodia. I was just reading about that earlier this week. But I think it's a question. I think there is this need for this shift of let's not just monitor the child, let's monitor the environment in which the child is in.
Well, thank you. My co-chair Diana has a question. Do you want to have a question for Luz? You want to come off and
Thanks. Yes, Luz. Well, this is a question for Luz, but really I think for others as well. As we think about parents and grandparents and others, other caregivers and advocates for children who are clearly very concerned and really do have the future of their children in mind, how can we best support them as advocates? What can we do to empower them and give them the tools that they need to raise their voices?
I would say considering and listening to us, our voices need to be on the table every time decisions are made on this matter. And no one will be a better advocate for young kids than parents and grandparents. So I think involve us, our voices and listening to us. I think that's I would say somebody have something to add to this answer. Thank you.
get them involved? I like that one. Dr. Lynette, you have a question for Aaron? You can come off mute.
I do, but I had so many questions for so many. I have to find my question now, Antoine.
I see it online.
So I was sharing that I appreciated your comment about health equity and that health equity requires climate action. And I was curious about successes in other child-connected disciplines that are raising up climate and how they're bridging those messages. As we're thinking about early care and education, are there other child-connected disciplines that we potentially might learn from to activate our field?
It's such a good question. I think there actually are quite a few. And I think the folks who worked on health equity independent of climate are really good exemplars here. There have been a lot, I think, of programs implemented both in the United States and around the world that have understood and intervened upon sources of health disparities that I think are compelling. They've made clear that children are not living to their full potential because of inequities, and when those inequities have been identified. And I think people have been very concrete, and I think, and this speaks to a question I think Andrew Garner put in the box. I think the more the frame can be put into how climate actions can advance health equity, the more successful we'll be. It's very easy to talk about how bad things are for kids in health equity, and it is absolutely true, but it may not be so motivating. And so I think those would be the two things. I think there's a lot to learn from folks in child health equity who've worked on that, all the issues around that. And I think that the frame of how, and this gets back to looking at the policies that are proposed, but what they can do to health equity. A great example is air quality rights. So, I mean, this is a one concrete example I can point to. So in Oakland, and this actually speaks to some of the points Laurence was making about understanding the environment. You know, air quality monitoring in most places is done at a regional scale, which is helpful. but it actually doesn't help us understand what a child may be getting exposed to from, for example, air traffic. So in Oakland, they did block by block air quality assessments. They linked it to health records. They showed that on average, 1 in 5 children in Oakland has asthma from breathing tailpipe exhaust. But in lower wealth communities and communities of color, it's more like 3 in 5. But you could only see that if you actually measured the air quality at a block level, because tailpipe emissions only go a very short distance. And with that, it became a much more compelling piece of advocacy around transportation policy, saying, actually, we do need to pay more attention about the freeways and the exhaust and the ports, because at a regional level, those effects are invisible. And so that to me is just one example of bringing those points together.
And, I think that building on that, I think that we have to create partnerships with those groups that are already doing air quality monitoring. We have to bring partnerships. I mean, all of us want to know in the Inflation Reduction Act, what's in there that can help our field, electrify our buses and Head Start. And so, those partnerships at the community level are going to be absolutely critical, because we can't do this alone, and they can't do it without us.
So we have 3 minutes left, Jackie. We got a question for you and our online viewers. Apart from policy, what can our programs and organizations do to prepare for climate change? Thinking about divesting from fossil fuel dependency, energy, providing educational resources, etc. What say ye?
Yeah, thank you. I think that we can, right, policy can have kind of a glacier-like progress, but one thing we can do is actually shift how we are. There's a lot that we can do within existing policy systems at the local level, starting our own local food efforts, for example, so that we're not shipping, trucking, and so forth, food from different places, but we're actually growing good food locally. We can start to have local energy systems, local microgrids, so that again, we're not getting our energy from fossil fuel-based energy production. We can really advance more localization in terms of local manufacturing, the kind of more of a maker economy, so that we're not, again, shipping, trucking, and all that, the emissions that come with that. So these are some of the ways that we can actually mitigate the impact, the climate change, by not having as much in the way of emissions from energy production, from food production, and from manufacturing in general. So those are just a few examples of things that we can do really in our communities to make the shift.
No, I appreciate that. I think it's important that we think through that. Laurence, in the last minute before I turn it back over to my co-chair, here's a question I need you to ask for me, because I'm still fascinated by other people doing things before us sometimes. Was there a message in the countries that you talked about that home true in those countries that decided to do something about it? Did they get it in some way? Was there a message, or was it the will of the people or the will of the government, or a set of circumstances that happened?
I mean, I think what I've been able to glean from our analysis is that, I went looking in those reports, looking for sort of the best examples that the US could try and replicate. I'm with you that it's not that there's some gold standard approaches that, if only we understood that, we'd know what to do. Mm-hmm. It's about whether there is that kind of critical mass of people, and that alignment with the government who kind of see the urgency of the issue. There are a lot of the countries who get it are those who are facing it most urgently. There's no doubt about that. Absolute no doubt. It clearly helps if it hasn't become such a polarizing issue in your country. And there's a number of countries where it's become highly polarized. But what I see when I look at those different countries is this sort of increasing share of countries who get it and who are trying to act. Some are better equipped to act than others because they have the resources. But there's no doubt there's an increasing number of countries you can see are really on board. That's very positive. But as I said, in the one negative thing there, was sort of slightly less positive, is that the kind of recognition of the centrality of children, that's lagging a little bit further behind. Again, we're seeing progress. We just got a little bit far still to go.
Thank you to our all of the panelists. This has been a great conversation, and I know it could go on for quite a while. Unfortunately, we have to stop, but so appreciate you lending your expertise and your voice to this important effort. Antoine?
No, thank you so much. I feel like going into overtime, but I want to be respectful of folks' time. But please continue to support what we're trying to do. And we really appreciate you guys taking the time to lend your experiences to us.
And thank you to everyone who joined us today. The next public listening session of the Early Years Climate Action Task Force will be on November 4th at 2 p.m. Eastern. And during that session, we'll take a deeper look at the impacts of climate change on children's health and strategies to support healthy early development in the climate change era. Have a great